A lot of you have been talking tonight about these government health care plans that you've proposed in one form or another. This is a show of hands question, and hold them up for a moment so people can see. Raise your hand if your government plan would provide coverage for undocumented immigrants. Okay. Let me start with you, Mayor Buttigieg. Why? Mayor Buttigieg, why?
Because our country is healthier when everybody is healthier. And remember, we're talking about something people are given a chance to buy into. In the same way that there are undocumented immigrants in my community who they pay sales taxes, they pay property taxes directly or indirectly. This is not about a handout. This is an insurance program. And we do ourselves no favors by having 11 million undocumented people in our country be unable to access health care. But of course, the real problem is we shouldn't have 11 million undocumented people with no pathway to citizenship. It makes no sense. And the American people agree on what to do. This is a crazy thing. If leadership consists of forming a consensus around a divisive issue, this White House has divided us around a consensus issue. The American people want a pathway to citizenship. They want protections for dreamers. We need to clean up the lawful immigration system, like how my father immigrated to this country. And as part of a compromise, we can do whatever common sense measures are needed at the border. But Washington can't deliver on something the American people want. What does that tell you about the system we're living in? It tells you it needs profound structural reform.
Vice President Biden, I believe you said that your health care plan would not cover undocumented immigrants. Could you explain your position?
I'm sorry, I beg your pardon.
I believe at the show of hands you did not raise your hand. Did you raise your hand?
No, I did.
Okay, sorry. So you said they would be covered under your plan, which is different than Obamacare.
Yes, but here's the thing.
Can you explain that change?
Yes. You cannot let, as the mayor said, you cannot let people who are sick, no matter where they come from, no matter what their status, go uncovered. You can't do that. It's just going to be taken care of, period. You have to. It's a humane thing to do. But here's the deal. The deal is that he's right about three things. Number one, they, in fact, contribute to the well-being of the country, but they also, for example, they've increased the lifespan of Social Security because they have a job, they're paying a Social Security tax. That's what they're doing. It's increased the lifespan. They would do the same thing in terms of reducing the overall cost of health care by them being able to be treated and not wait till they're in extremis. The other thing is, folks, look, we can deal with these insurance companies. We can deal with the insurance companies by, number one, putting insurance executives in jail for their misleading advertising, what they're doing on opioids, what they're doing paying doctors to prescribe. We could be doing this by making sure everyone who is on Medicare, that the government should be able to negotiate the price for whatever the drug costs are. We can do this by making sure that we're in a position that we, in fact, allow people. Time's up.
I just want to address that point.
Actually, you can hold off a minute. We need to take a short break here. We got a lot more we need to talk to all of you about, so stick with us. We're just getting started. We'll be back with more from Miami right after this.